Hi everyone, my name is Marion, Gilles and I'm the Service Manager for Police Custody Healthcare, Prison Healthcare and Forensic Medical Services in NHS Highland.
And I'm Bev Fraser, so I'm the Strategic Lead for Drug and Alcohol Recovery Services, which covers all of Highland and has a particular focus on delivering on the MAT standards.
Today we're going to present a project called MATPACT, Medication Assisted Treatment Pilot at Custody Toolkit. And you'll see here, we've named it Finding Scotland's Forgotten Generation. We find that often our population in police custody are often forgotten about. As our kind of staffing group as a whole, we're often referred to as a Cinderella service. So that's why we've named it the Forgotten Generation. Quite often, the population that we see in custody healthcare may be their only touch point in healthcare that they receive. So it's really important to be able to utilise that opportunity while we have it.
So today we're going to take you on a wee story. We've decided to do this presentation in a wee bit of a different style. So we're going to use the Pixar storytelling framework to tell the story. I don't know if anyone's familiar with it. It's used in quality improvement methodology quite often. So it really goes beyond the solution and looks at the impact and really tells the true value of the story. And the hope is that it will be memorable and it will travel further and inspire people to learn more about it and take significant action.
So once upon a time, in a land far away in the north of Scotland, in a place called Burnet Road Police Station in Inverness, there was a custody healthcare team who attended work every day and looked at the work they had to do in hand. This team consisted of one healthcare support worker, 7 nurse practitioners, a senior charge nurse, a service manager. There's only one nurse on duty per shift and the Burnet Road cell block has a capacity of 24 cells. Every day, the team would come to their work, look at what the working day entailed and get down to the task in hand. Healthcare referrals are received from police staff based on the police admission questions. The police decide who would see healthcare based on their understanding of who needed seen. Our healthcare approach was reactive and not proactive. One day, the service manager and team lead were discussing why Scotland has such a high rate of drug-related deaths, and that 19% of drug-related deaths in Scotland had been in the police custody within the 6 months prior to their death. A gap was identified. We reflected on the referral process in conjunction with the MAT standards that all persons at risk of drug-related harm should be proactively identified. The police admission questions on admission to custody is a set of 21 questions which are standardised and asked nationally across Scotland. Included in these 21 questions are 4 questions in relation to drug use. So we identified that people who were answering positive to these questions weren't always being referred to health, and that was essentially our gap. So because of that,
this is where my role came in. So having never worked in a police custody suite at all, ever in my life, it opened my eyes quite a lot. So we got together, we spoke as a team. So initially, myself, Marion, service manager, and Paul Rusk, who is the lead of the team, to really discuss and try and analyse actually what is actually going on in our service just now. Why is this happening? So we used this fishbone analysis here, this fishbone analysis tool. So really recognising that our systems, we were using different police systems, we're using different NHS systems. They don't always tie in together. There's information being said of one and not of another. Communication, so even communication between ourselves and the police, we could tighten up on that. We identified that we could do that. Were we involving our people that came through the door? Not always. So how could we make things different there? Also, awareness of the MAT standards. What we realised was that not everybody had a true awareness of what the MAT standards were. In fact, there was quite a lot of denial as to what they were. So realised that there was some education needed there too. And again, roles and responsibilities. So really being clear about what is within our role, what's in police constabulary role as well. So we did a lot of sort of analysis around that. So we used quality improvement methodology, as I've said. to really understand the problem and develop a theory of change. So to develop theory of change, we used a driver diagram. So within that, our fish head here says, why are people identified at risk of drug-related harm not being referred to health? So we flipped that on the head and said, right, what do we want our aim to be? So we wanted our aim initially to be to take it up to 60% of people, with the aim further to be 100% of people being referred to custody. So that was our aim. We looked at our primary and our secondary drivers, and then looked at what we could do to potentially change that. So from then, we looked at, do you know what, how do we know that what change that we're going to do is actually going to make an improvement? So we then looked at our baseline measurements. What do we need to achieve first to be able to know if we're making a difference or not? So we firstly identified that we needed to know how many people were coming into health, how many missed opportunities were we having. Also looking at, our harm reduction. So what are we offering? Are we giving out take-home naloxone? Are we asking people, do they want BBV testing? What is it we're doing? So we had to get a baseline for that. So we soon realised we couldn't do this on our own and we needed help with our police colleagues. So because of that, we developed the MATPACT form. So this is what you're seeing here on screen. So the first 4 questions there are what is asked by the police, which Marion referred to earlier on. And the rest of the MATPACT is really we call it a toolkit, but it's about what intervention are we offering. So, are we offering safer drug use advice? Are we offering take-home naloxone? With BBV testing, are we offering immunisation? We kind of started off with just MAT4, so just the harm reduction, but it spiralled a wee bit out of control. So we used PDSA, Test to Change. So this is version 3, I think, as you're seeing on the screen, which is going through clinical governance just now to see if we can get use sort of Scotland-wide. So it started off with MAT4 harm reduction. We then looked at, can we enlist people, so can we engage people to commence on OST within custody? Can we continue people on OST in custody? We have also got another improvement project, so looking at who is classed as high risk of drug-related harm. And it spiralled a wee bit, I suppose, now, because we're looking at how do we get MAT 6 and 10 in this? Can we offer some wee decider skills within custody? And we're now offering a phone call to breathing space. So until finally the end of the story, this is the biggie for us. So you can see here in the bottom right-hand side of the slide that there's a percentage of missed opportunities from police. That was really high at the beginning of the project. So you can see that there's 10 points in the yellow dots there, so showing a period of sustained change. So we have actually increased by, I think it's 12% at that point. Our PDSA 2 that you can see here in the bottom slide was we made a slight alteration to MATPACT because we weren't getting the results we were hoping to get. And what we realised were people that were coming in with suspected drug driving offence, then they weren't answering yes to the questions, so we adapted it so they would automatically trigger a referral to MATPACT. So really happy with these results. Our naloxone accepted again went from an increase, the baseline of 83%, and again BBV testing, so we had increased that baseline by 188%.
So our main aim was to reduce drug-related deaths, and information we received just yesterday was in the 6 months prior to MATPACT. Within the 6 months, MATPACT just completed yesterday was 6 months completion. That the drug-related deaths that we've had in Highland that have been in police custody for the last 6 months have been able to be reduced by 85%, which is obviously a significant result for us. Not to say that there isn't other contributing factors, but I think that we can agree that we're doing something right and it's going in the right direction. So for MATPACT to continue, we're hoping that this will be able to be rolled out nationally across custody suites, right across Scotland, the likes of ED departments, GP practices. It's a short, sharp, but very important intervention while you have patients with you that might often slip through the net or not turn up to appointments. And, our patients are very different. They're brought to us. They don't choose to attend, so let's use that opportunity while we've got them. And just some patient feedback before we move on to the end. We have had a bit of patient feedback who was a person who accepted naloxone in custody and on readmission to custody was able to provide some feedback that he had actually used that naloxone to save a life and wanted more than one kit to go back out with. So that was some positive feedback from patients. And then MATPACT had recently won an award for winners of leading in quality insurance at the recent Mental Health Forum Awards. So we're hopeful that we're able to continue to share this good practice and more than happy to link in with anybody in your area of practice who's keen to utilise our intervention. Thank you.